Today we're talking about opioids, and they are, without a doubt, one of the most powerful and controversial tools in all of medicine. For people in agonizing pain, they can be a total lifeline. But they also come with some really serious life-altering risks. So let's get into it. I mean, just imagine that for a second. What if you could just flip a switch and turn off pain? The sharp, blinding agony of a broken bone, the long, grueling recovery from major surgery, just silenced. That right there is the incredible promise of opioids. But to really get how this off switch works, we first have to understand the alarm system it's designed to control. And the problem, of course, is pain. But pain isn't just a feeling, right? It's so much more than that. It's your body's critical alarm system. It's basically screaming at you that something is wrong and you need to pay attention now. Okay, so how does this alarm actually work? Well, it's pretty much a three-step deal. First, your nerve endings out in your body detect some kind of damage or threat. Second, they fire off this electrical signal that zips up your spinal cord. And finally, that signal hits your brain, which processes it, and that's when you actually feel the sensation we call pain. It's an incredibly efficient system, but man, it can be completely overwhelming. And that's where opioids enter the picture. For centuries, medicine has been searching for a way to just silence that alarm, especially when the pain itself becomes the biggest problem. Well, opioids are that powerful off switch. So what are these things, really? Opioids are a whole class of drugs, and their main job is to physically get in the way of those pain signals. They work by latching onto these special sites on your nerve cells, which are called opioid receptors, and they basically tell the whole alarm system to just quiet down, stopping that pain message before it ever gets to the brain. The best way to picture this is with a lock and key analogy. Seriously, it's perfect. Think of your nerve cells as having all these tiny little locks on them. Those are the opioid receptors. Opioids act like perfectly shaped keys. When an opioid molecule finds one of these locks, it fits right in, turns, and just like that, the cell goes silent. The pain signal is stopped dead in its tracks. But of course, it's not quite that simple, because there isn't just one type of lock. Let's look at two of the most important ones, the mu and the kappa receptors. Hitting that mu receptor brings on that powerful pain relief and even a sense of euphoria. But, and this is a huge but, it's also responsible for the most dangerous side effect, slowed breathing. Activating the kappa receptor also knocks out pain, and with less of that breathing risk, which is great. The catch? It can cause some really unpleasant feelings, like unease or even hallucinations. And this is the puzzle drug designers are constantly trying to solve. So, just like there are different locks, there are also a whole bunch of different keys. The term opioid doesn't just refer to one single drug. Nope, it's a whole family of them, and they have different origins and wildly different strengths. Let's take a quick look at this family tree. It all starts with the natural opioids, like morphine, which come directly from the opium poppy plant. Then you've got the semi-synthetics, like oxycodone. That's where chemists take that natural molecule and tweak it in a lab. And finally, you have the fully synthetic opioids, like fentanyl, which are created completely from scratch in a laboratory, with no connection to the plant at all. And this right here shows you the massive difference in power we're talking about. When administered parenterally, fentanyl is roughly 100 times more potent than morphine. 100! That incredible strength is what makes it a fantastic surgical anesthetic, but it's also exactly what makes it so exceptionally dangerous outside of a controlled medical setting. And that brings us to the core of the issue, the complication, the other edge of that sword. Because the very same mechanism that makes opioids so incredibly effective at stopping pain also creates a whole host of serious and sometimes life-threatening problems. The first major issue is tolerance. What happens is, over time, your body just gets used to the drug being around. So the same dose that once gave you complete relief might barely take the edge off a few months later. This often leads to needing higher and higher doses just to get the same effect. And running right alongside tolerance is dependence. Now, this is really important. Dependence is not a moral failing. It's a physical state. Your body has literally adapted to the constant presence of the drug. So if you suddenly stop taking it, your body protests with these deeply unpleasant, flu-like withdrawal symptoms. But crucially, this physical adaptation is not the same thing as addiction. Opioid use disorder, or addiction, is different. That is a chronic brain disease. It's characterized by a fundamental loss of control, this overpowering, compulsive need to use the drug even when it's causing devastating harm to your life, your health, and your relationships. Opioids come with a whole menu of side effects, from common problems like constipation and nausea to classic signs like pinpoint pupils. But one side effect stands alone as the most dangerous of them all: respiratory depression. That's when the drug slows or even completely stops a person's breathing. This is the primary cause of fatal opioid overdoses. So, given these immense risks, how do doctors even begin to harness the benefits of these drugs safely? Well, this brings us to the safety net, the clinical strategies, and the tools that are designed to manage these risks. At a public health level, this includes harm prevention programs. For example, take-home naloxone kits can reverse a potentially fatal overdose in just minutes. Needle and syringe programs help reduce the spread of diseases. Things like this are all designed with one single goal in mind: to keep people who use drugs safer. And in a doctor's office, managing long-term pain is a highly calculated process. When a patient builds up a tolerance, doctors don't just keep increasing the dose forever. Instead, they might do what's called an opioid rotation. They use careful calculations to switch to a different opioid, figure out the equivalent dose, and then apply a big safety reduction, just in case. It's a continuous balancing act of monitoring and adjusting. And finally, we've got the ultimate safety tools, opioid antagonists. These drugs do the exact opposite of opioids. They literally kick the keys out of the locks. Naloxone is the emergency brake. It works in minutes to reverse an overdose and save a life. Naltrexone, on the other hand, is more like a long-term guardrail. It's used to block the effects of opioids to help manage addiction over time. So, at the end of the day, we're left with this fundamental challenge. Opioids are an indispensable tool, a true medical marvel for managing severe pain, but they also carry this potential for immense, devastating harm. The central question for all of us, for patients, for doctors, and for society, remains: how do we find the right balance?